So thank you very much for that nice introduction. Good morning, everyone. I hope we're all feeling refreshed, not too many headaches after last night. It was a good party, wasn't it? I had a very nice time. But I had to be sensible, so I was on the first bus back to the hotel because I had a lecture to give this morning. I have to thank Professor Al-Yafufi for a very nice lecture on a similar topic and also for setting up some of the basics for the lecture that I will give you. And she very elegantly spoke about the genetics and the microbiology, which I will not cover in my presentation today. So let's see if we can advance. Thank you very much. So we know that implants are a wonderful modality for replacing missing teeth for our patients. But we also know, and this goes back some time now, and this is a quote from Tonetti in 1998, that although we have successfully integrated implants, there are complications that can lead to the loss of those implants. And of course, biological complications is what we're talking about today when it comes to mucositis and peri-implantitis. We also know there are hardware-based complications, and there are also aesthetic complications. So implant dentistry is very much like dentistry in general, that whilst we have predictable procedures, we also have to deal with things that don't always go well and where complications arise. And I think it's imperative and it's important for us to understand that wherever possible, we need to limit the risk for complications as far as possible, because ultimately this affects our patients. So what I'd like to do in the presentation this morning is to cover a few things. Firstly, I will go over the definition of mucositis and peri-implantitis and bring you the new definition from the periodontal workshop that was held in December last year, which I was a part of. I will look briefly at pathogenesis, and then also, which is the thrust of the lecture, the risk factors for peri-implant infections.